Dr. Cooke, how you doing?
I'm well, Miss Harper. How are you?
I'm doing really good. I'm here because I'm interested in birth control, so I was hoping you can help me.
Do you have a type of birth control in mind?
I definitely want something non-hormonal and a barrier method product, which I was reading up on.
Well, let's see here. I do have something that appears to be up your alley. I have some Spermicide, Cervical, and the Diaphragm.
Oh, okay, sweet. So I guess these are the barrier methods, and then this is the chemical.
Yes, that is correct.
Okay.
Now, the Diaphragm here is 94% effective, while the Cervical cap is 92% effective.
Oh, okay.
The Spermicide as well is 72% effective.
When used alone.
No, these are hormone-free,
Okay.
latex-free, so it's easy use for application.
Okay. After practicing.
Of course.
Okay.
And mild to no interference.
For the partner, I guess, or for both of us?
For both of you.
Okay.
Once you establish a routine, you should feel like you have nothing.
Okay. And so, like, the mechanism of action is just basically, like, they act as a barrier product to prevent pregnancy, is what I guess?
The diaphragm and the cervical cap, they cover the cervix.
Okay.
Okay? And then the spermicide, it slows down sperm from reaching the uterus.
Mm-hmm.
These combined are to prevent pregnancy.
Oh, okay. Sweet. That's the goal.
Yes.
And then I was reading on advantages and disadvantages of all three of these. And so I did read that advantages is for the sperm, or not for spermicide, but for cervical cap and diaphragm, is that it doesn't affect future fertility.
That's right. But you have to use it every time before intercourse.
Okay.
So that is an advantage as well. And let's say if you were breastfeeding, it's able to be used.
Okay, that's really good to know. And then disadvantages could be also having to insert it every time, like you just mentioned. And then I can't really think of anything else because it said it didn't have any side effects. So
right, that is true. No known side effects.
Okay.
Now, I will say that these methods are less expensive compared to other oral contraceptives.
Okay.
So an advantage would be that you're able to use these with other contraceptives.
Okay.
Such as
like condoms or oral contraceptives?
Yes,
okay.
Very much.
And then a disadvantage of spermicide would be it can cause irritation, is what I read.
Right, and put you more at risk for HIV or sexually transmitted infection.
Okay, that's something I need to think about. But I did read that gels and foams work instantly when applied.
Yes, they do. Meanwhile, suppositories and films, they take up to 30 minutes to work.
Okay. I think so. I was reading also that the diaphragm and cervical cap have a varying times at which they can be applied. Like the cervical cap can be applied 6 hours prior to sex, as well as the diaphragm can only be applied up to 2 hours before sex.
That's right. And then also, if you're going to have several rounds of intercourse, it's important that you reapply the spermicide within 2 hours.
Oh, within 2 hours.
And make sure that you keep the diaphragm or the cervical cap in place for a minimum of 6 hours before removal after sexual intercourse.
Well, so speaking of that, how long can I keep these in for? Like, can I keep them in for a week or?
Oh no,
okay.
That's going to definitely put you at risk for toxic shock syndrome.
Okay.
With the diaphragm, it should remain no longer than 24 hours.
Okay.
And the cervical cap should be no more than 48 hours.
Okay.
The spermicide will disperse with bodily fluids.
Okay. Can you tell me some information on risk and precautions?
Yes. I have my chart here pulled up, and I just wanted to let you know that with these, they are reusable.
Oh.
So you can wash them, but you are at risk for infection because it's invasive. Anytime that you're going into the body, you're at risk for infection. So it's very important that you wash your hands thoroughly before using these methods.
Okay. All right. And then I was reading for precautions. I can't use them while on my period. Again, because
definitely you're not able to use them while you're on your period. It's contraindicated that if you have a prolapsed bladder or uterus, that you do not use this.
Okay. And then I was reading up on side effects, and it said that there were no side effects for these two, for the Kaya and the cervical cap. Is that true?
Yes, that is true.
Oh, okay. But spermicide, again, causes the irritation. And I'm kind of on the fence only because I hear neither one of these products protect you against STIs. UTIs, which I think you talked about.
They do not, and that's definitely a disadvantage. That's why it's recommended that you use another form of contraceptive, such as a condom.
Okay. Is there anything I need to know before I talk about like how I can get this product?
Well, in order for you to get this product, you would need a prescription from a healthcare provider like myself.
Okay.
You can get it at any pharmacy or mail pharmacy. It's just important that you have a prescription. Now, the diaphragm is more accessible than the cervical cap. Now,
Okay.
with the Kaya, it is contoured to the body. So, one size fits most. The cap, you need to be fitted.
Okay.
And spermicide, you don't need any.
I can buy it over the counter.
Yes.
Okay. I did read that cervical cap in like the original diaphragm, I guess. You had varying sizes, so if you became pregnant or gained weight, you had to get a different size.
Yes, if you gain more or less of 10 pounds, you're going to need to be refitted. If you have had a vaginal birth, you're going to need to be refitted. And you also are not able to use it within 6 weeks of postpartum.
Okay. Can you tell me cost again? Because I read that they can cost up to $275.
That is correct. It's best to go through your insurance. However, the cost varies.
Okay. And spermicide is $1 over the counter.
You can definitely get it over the counter. The price range varies for that as well, but you have easier access to spermicide.
Okay. I appreciate talking to you.
Since we've had a discussion about diaphragms, cervical caps, and spermicide, I'm going to ask you to demonstrate it for me, since you appear to be an ideal candidate who has not had any recurrent UTIs or sexually transmitted infections.
And I have no history of vaginal delivery, because if I did, I would have to be resized and refitted. But still, it might not work the best.
Correct.
Okay, so this is a diaphragm, which works similar to the cervical cap.
Yes.
Before insertion, I have to make sure my hands are clean and dry. My area that I'm working is clean. And so my hands are clean and dry. I grab the product, and then I have spermicide. So I'm going to apply spermicide.
You want to ensure that you apply a teaspoon for the diaphragm cap, and for the cervical cap, 1/4 teaspoon of spermicide.
Okay. And so I apply it on the outer rim.
Yes.
So I apply it to the outer rim, and then I can apply it on the bottom for lubrication. Okay, so I applied that, and then I get into a comfortable position. So I can either be squatting, laying down, or I can be standing with one leg up.
Yes.
Okay. And so I'm getting ready to insert, and so I want to squeeze it together.
You want to do that with your dominant hand and open the labia with your non-dominant.
Okay, so I got that. So I got it. And then I'm opening the labia.
Yes.
And so then I'm going to insert up until I meet resistance.
Correct.
And then I continue to push with my longest finger, my middle finger, and then it should be in place, just like so.
You're going to use your cervix and your pelvic bone as a landmark.
Okay. And so what's going to happen is when the man ejaculates, if not wearing protection, it will meet this barrier and work to prevent from sperm entering into the uterus.
Yes, and the spermicide will slow the sperm down if it so happens to enter the uterus.
And then I can't take this product out, the diaphragm or the cervical cap, for at least 6 hours after sex.
That is correct. And if you're having several rounds of sexual intercourse, it's important that you reapply spermicide with the application.
Okay. And to release, I just go in with my middle finger and pull at the relief arch and then come out.
And that is correct. You want to make sure that you're in a comfortable position as you insert it.
Okay. Thank you.